Welcome to the deep dive. Today we're getting into the, well, surprisingly complicated world of socioeconomic status, SCS, and its really crucial connection to health disparities.
Yeah, and we're basing this on a really insightful article by Dr. Vickie L.
Our
Shavers.
mission for this deep dive to figure out why measuring SCS accurately is, frankly, so hard.
And how the different ways we try to measure it give us different pieces of the puzzle, sometimes even conflicting pieces.
Right, and what does all that actually mean for tackling health inequalities? How do we get practical?
Exactly. So let's unpack SES first. At its core, it's about where an individual or family sits in the social structure.
Based on things like wealth, prestige, power. It's meant to capture access to, well, basic resources needed for good health.
hmm And that position deeply shapes health outcomes. Think about access to good health care, the environment you live in, lifestyle factors.
And the numbers are pretty stark. The article mentions these factors are tied to maybe up to 80% of premature deaths.
It's a huge number, which makes it kind of strange or paradoxical that studies looking at SES and health don't always agree.
Right. If it's that important, why the inconsistency?
Well, part of it is just how we measure it. The measures can be imprecise. Plus, getting good individual data is tough.
Like asking about income, people get cagey.
Yeah, exactly. High non-response rates are really common for income questions. And SES isn't static, right? It changes over your life.
Good point. And the article also mentions challenges classifying certain groups, like women or kids or people not in the traditional workforce.
Definitely. Standard occupational scales often don't capture their situations very well. So yeah, lots of measurement issues,
Okay, so the article lays out two main approaches to measurement. There's compositional.
which focuses on your individual stuff like education, income, job.
And then contextual, that's more about your surroundings, like where you live.
That's it. Your neighborhood attributes, the resources available there. Both are useful, but both have, well, drawbacks.
Compositional ones are common, but you mentioned income non-response. And occupation can be tricky for certain groups.
Right. Traditional job classifications often reflect, historically, male work patterns.
And the contextual measures, they look at the environment, which is valuable, but
But they don't always line up perfectly with individual circumstances. And there's that tricky question, does the neighborhood cause poor health, or do people with health issues just end up concentrated there? It's hard to untangle.
okay, so measuring SES is already complex, but then it gets even more complicated when we bring race and ethnicity into the picture.
Ah, yes. This is really critical. It's not just about general disparities between groups. There's this idea called the diminishing returns hypothesis.
Diminishing returns, what does that mean in this context?
It suggests that people from racial or ethnic minority groups might not get the same health boost from achieving a higher SES compared to white individuals.
So wait, even at the same level of, say, education or income?
Exactly. The health benefits might be less pronounced. For instance, African Americans might still face greater health challenges than white individuals, even when they have similar incomes or degrees.
Why would that be?
Well, it points to factors beyond just the individual SES metrics. Things like the ongoing impact of systemic discrimination, maybe chronic stress associated with being a minority, or unequal access to quality resources, even if you have the money. It suggests SES doesn't mean quite the same thing across different racial groups.
Wow, okay, so that has huge implications for research, right? And for policy.
Absolutely huge.
Yeah.
It means just controlling for SES in a study might actually hide important differences.
What do you mean by controlling, like trying to statistically remove its effect?
Yeah, researchers often use SES as a covariate, something they account for statistically to isolate the effect of something else, like race. But if the SES measure itself doesn't capture the same realities for everyone,
And then controlling for it could mask the real story.
precisely, it can obscure crucial disparities. That's why the article emphasizes stratified analyses.
Meaning you look within specific groups.
Exactly. Analyze the relationship between SES and health separately for different racial or ethnic groups, or for men and women. It lets you see if the patterns are different, which they often are.
Okay, this is all about understanding the problem better. How do we translate this into action, into better health interventions?
I think the key is moving beyond just labeling someone as low SES. We need to understand the specific pathways through which lower SES leads to poor health.
So not just low education, but maybe focusing on, say, health literacy. Like, can the person understand the doctor's instructions?
Exactly. Or maybe low income means they can't afford transport to get to appointments. Or maybe they live in a food desert without access to healthy food. It's about identifying those tangible barriers.
That makes sense. It allows for much more targeted help, addressing the specific barrier, not just the general label.
Right, because policy can't just magically improve SES across the board easily, but it can address things like transportation access or affordable housing or the availability of healthy food or ensuring health information is understandable.
So, future research needs to really pinpoint those concrete, actionable factors that link SES to health outcomes.
That's the goal. Find the levers we can actually pull. Things like the type of health insurance someone has or the community support systems available. Those are the things policies and programs can potentially change to genuinely reduce health disparities.
It really highlights how something we often treat as a simple category, socioeconomic status, has these incredibly deep and complex layers, especially when we think about how it impacts health differently for different people. What stands out most to you from this deep dive?